morning, except Sabbath when I don't eat breakfast, I give myself 18 hours where I don't eat so I can have less free radical damage and gives my brain sharper. So that's what I do. So, but those are things that they found help people be less depressed. So we'll go to this other item, and I'll do again. Let's see. So let's see. It's coming. Maybe I'll be more specific. It is. That's okay. So I don't know if I have enough of these. So if you're a couple, share. But, pass some of those. If you're a couple, just take one. And I'll save one for me. I meant to.
There's 2 pages.
Too many eyes.
There's 2 pages.
There's 2 pages. Sorry, there's 2 pages.
No, we just got one.
I'll skip a little part of this when he gets to talking about his concepts about why we are this way.
Depression affects more than 150 million people worldwide, making it a leading cause of losing healthy years of life as a result of disability. In fact, by 20...
So, we're seeing they think the National World Health Organization is saying that it'll be the #2 disease in the world, depression. So it's growing. And we think, and the studies are showing, there are inflammatory events that happen in people's lives even as children. And they've connected traumatic events as a child affecting heart later as an adult. You're going to see more of this coming out. So, anti-inflammatory, stress, how it affects you, cortisol levels, all that's going to be a big factor you're going to see in the next few years. We've known this in anti-aging medicine for a while, and Dr. Braverman. So
is that more epigenetics, or is this a different thing because of the residual effect?
This is residual effect.
Okay.
He's going to get into, and I'm going to probably skip a little section because I disagree. It makes no sense. I mean, and if you come to church, you'll see my little talk on this, why it doesn't. But anyway, he gets into somehow it increases mankind's survival. That's what we're seeing, increase in depression. It helps with our natural selection, like we're going to get better and going. I don't think so.
One other question about depression. Do most depressive people, we don't see them in society, are they homebodies, or how do we recognize the increased depression levels? Do they stay under the radar?
That's what he gets to
Okay.
into this in here.
Never mind.
Well, no, but I'll let him explain it, his theory.
20, depression may be the second leading cause of healthy years of life lost, second only to heart disease. Why is depression so common? Well, it is said nothing in biology makes sense except in the light of evolution.
So here's where I'm going to...
Why would we evolve to get depressed? Depression poses a baffling evolutionary puzzle if it has such negative effects, but
Yeah, and that should be a baffling evolutionary puzzle, because if we are getting better and we are getting more evolved, then why are we having more of this depression? So his argument is that, well, if you're depressed, you stay at home, and then you're not exposed to people who are sick, and there's less people who die. That is not logical when you think of, because if you look at the rate of people who are depressed, they die sooner.
Right,
So it's, his rationale is complete. So I just want you to hear my point before he creates his irrational point.
yet it remains so common and heritable, meaning a big chunk of risk is passed through our genes. So there must be some kind of adaptive benefit. Otherwise, presumably, it would have been naturally selected against. Maybe depression is an evolutionary strategy for defense against infection. Infection has been the leading cause of mortality throughout human history. The average life expectancy was 25, and it was not uncommon for half our kids to die. With such stark capabilities, infection has been a critical and potent driving force in natural selection. When we become infected, there's a surge of inflammations. Our body mounts a counterattack. And then what happens? We feel lousy. We feel sick. We get weak, tired, slow, and sleepy. We don't want to see anyone. We don't want to do anything. All we want to do is sleep. It's like we're depressed. And that's,
He says, it is this notion suggests that sickness behavior is an expression of a biological, mediated, motivational state. Isn't that a bunch of hooey? Anyway, triggered by the innate immune system that resets an organism's priorities to adaptively cope with the threat of bodily incident. So what he's saying is, okay, so now depression can make you sick, right? No, he's saying depression keeps you from getting sick, and it's an adaptive component to cope. Now, I'm sorry, he's mixing two arguments here. Depression will cause pro-inflammatory cytokines. Depression will cause the sickness. It'll cause you to be listless. Depression will cause a number of biological things in your body that you don't want to have. It'll cause you first to have stress, your cortisol levels go up, then it causes them to drop, then it causes fatigue when they drop, then it causes you to not do as much, it causes you to isolate, it causes you to have greater risk of heart disease, stroke, cancer. So how does that make the species survive longer? Excuse me, this is gobbledygook from scientists. He's a scientist, he's knowledgeable about many things, but when you take this study and you try and fit the square peg in a round hole, you have to admit it's not fitting.
Well, I agree with you, but if you go back a ways, in medieval times, that's because
Right.
they used to close the doors to protect themselves.
Right, from the plague, or something like that. So what I'm saying though is he's using an argument that was socially connected back in the Middle Ages to our modern days, which I think 1,000 years have transpired or something like that. And so we've had a survivability issue here. We've actually increased our longevity, and he's saying because of the plagues and things that people avoided infections, but we've increased survivability because of science and antibiotics. That's what's increased our age.
And also,
And
if you look at depression, if you look at it as a modern, because it's accelerating, and we're actually eating better than we ever did in the world, it might not have, it does have something to do with diet, but it might not have generally something to do with diet, but our lifestyle, our mental thinking.
right, it could be lifestyle, mental thinking, correct, and it could be that the diet, you're right, we're getting more bioavailable foods, unless there's probably less starvation on a worldwide basis. But the types of foods we're getting are now in our modern society, at least in the Western cultures, and that's why they have these blue zone diets that show people in the more I shouldn't say Western culture, but more agrarian cultures or more, those people are living longer because of the foods they're eating.
Right.
This just goes to the very beginning of our conversation, which you brought up, where studies where you have to actually tease out and with
See.
our knowledge of,
That's right.
you have to discern what you're reading.
You have to discern the motivation of the study. So that's why this study says, well, maybe it's a motivational state triggered by innate immune systems that sets an organism's priorities to deftly cope with the threat of bodily insult.
Well, his motivation is to promote evolution.
Right,
Yes.
So
right,
you have to understand his motivation.
exactly. You have to understand that he believes a certain way.
Yeah.
And his belief is affecting his thinking because he has to fit he believes that everything's a round peg and it's gonna have to fit in the square hole. Because it's all of a sudden the facts are coming out that doesn't make sense. But how am I gonna get this? Okay, I'll create this kind of argument that is really pushing the envelope way out there.
Right.
But the rest of the tape is okay.
Great for fighting infection. Not only does it help us conserve energy so we can put up a good fight, but reduces social contact. We're not running around infecting everyone. It's the same reason we evolved to think poop doesn't smell good or decaying flesh. That keeps us safe from infection. In fact, we see this phenomenon with other social animals like honeybees and mole rats who feel impelled to crawl off and die alone when they get sick, which reduces the risk for the rest of the community.
So here he's trying to say that these natural animals are creating, they thought about dying separately from everyone else. Now, I'm not sure an animal thinks that, but an animal might crawl out to do that because he's not feeling comfortable. I know my dog, when he had a flipped stomach, he crawled off to the golf course to be alone and he died there. It was a sad thing, but that's what happened. But he wanted to be alone, he was in pain. And so sometimes that's not the answer. But again, we put our anthropomorphic mind and we put it into an animal and say, well, that's maybe what they're doing. We don't know what they're doing for sure. Did they do a study on bees that crawl off by themselves? I don't think they did. So, but again, and then he brings it into the level of complex communities, altruistic self-sacrifice, often leaving the hive or burrow to die when they ill, reducing the risks for others. It's a pretty, but those are lower species too.
More likely they got shunned by the society.
Right, society says, hey, you're not doing the bee dance right, get out of the hive.
Yeah, that's more likely.
Well, plus, we know that if we're sick, we want to be alone. And that's feelings.
Right,
And
exactly.
animals have feelings.
Yeah,
It has nothing to do
that's
with
right.
intellect.
Doesn't have to do with intellect, no, it's a feeling thing. So, but what I'm saying is he's trying to make it, he's putting it into this altruistic, what? An animal? No, he's feeling badly, yeah. You're right.
The relationship between mental health and inflammation was first noted in 1887, for which the only psychiatrist ever win the award got a Nobel Prize. But what evidence have we accumulated in the centuries since that inflammation causes depression? Well, people who are depressed have raised inflammatory markers such as C-reactive protein. Inflammatory illnesses are associated with greater rates of major depression. Indeed, that's what's found in a variety of inflammatory conditions, including more kind of benign inflammatory conditions like asthma and allergies. And, that's important, suggesting the mood symptoms are not simply, feeling bad about having a terrible disease, but, may be directly tied to the inflammation. And most powerfully, you can actually induce depression by inducing inflammation. Like when we give interferon for certain cancers or chronic infections, up to 50% go on to suffer major depression. Even just giving a vaccine can cause enough inflammation to trigger.
Absolutely. This is again, 2 points I want to make here. That many times because people have Hep C, they're given interferon to treat the Hep C. That's a disease that affects the liver, it's a virus. And you get it from transfusions, sexual transmission, other ways. But they have us screen the patient for depression before they give the interferon, because they've had suicides as a result of the treatment. So you can see that the interferon would aggravate. So they want to make sure the patient's stable before they start the treatment. The other thing is, when he's talking about vaccinations, I've had patients who've been vaccinated and who have developed terrible side effects of depression since the vaccination. They got the flu vaccine, didn't realize it was going to have some long-lasting consequences for them. So people are sensitized, and he talks about the depression following hepatitis B vaccination, hemodialysis. And the reason to give that to hemodialysis patients is because Hep B is pretty common, and they're trying to prevent them from getting it if they get a transfusion.
Depressive symptoms. Taken together, these studies are strongly suggestive of inflammation being a causative factor of mood symptoms. So, can an anti-inflammatory diet help prevent depression? We didn't know until about 43,000 women without depression were followed along with their diets for about a dozen years to see who became depressed. And it was those who ate a more inflammatory diet pattern, characterized by more soda, refined grains, and meat, suggesting that chronic inflammation may underlie the association between diet and depression. Normally, we think of omega-3s as anti-inflammatory, but they found fish to be pro-inflammatory, associated with increased C-reactive protein levels, consistent with recent findings that omega-3s don't seem to help with either depression or inflammation. The most anti-inflammatory diet is...
The other thing to note that they found also a high rate among red snappers and a few other, and there's one other fish, perch or something, that their bodies are getting, they hold on to the neurotoxins that are in the water. So you think you're getting nice fresh red snapper or something like this. And so it may not just be the omega-3s, it could be the toxins that are in the fish.
Plant-based, which can cut C-reactive protein levels by 30% within 2 weeks, perhaps because of the anti-inflammatory properties of antioxidants. I've talked about this before, but never really explained why antioxidants are anti-inflammatory. See, oxidative damage caused by free radicals may cause an autoimmune response in the body by changing the chemical structure of otherwise ubiquitous molecules to generate new structures that the body attacks as foreign. For example, when LDL cholesterol gets oxidized, our body creates antibodies against it and attacks it. And so, clinical depression can be accompanied by increased oxidative stress and the autoimmune inflammatory response it creates. Free radicals lead to autoimmune inflammation. Where else does inflammation come from in our diet? Endotoxins. Right? It's worth reviewing how the endotoxins in animal products can cause a burst of inflammation within hours of consumption. What does it do to our mood? If you inject endotoxin into people, within a few hours, inflammation shoots up, and so does feelings of depression, as well as feelings of social disconnection between people. Although previous research has demonstrated that inflammatory activity contributes to depressive symptoms, no work in humans has examined the effect of experimentally induced inflammation on anhedonia, the lack of reality.
Yeah, anhedonia is the lack of reality of pleasurable stimuli. It's one of the key symptoms of, we call it negative symptoms of depression, and negative symptoms of schizophrenia. Schizophrenia has positive symptoms. It doesn't mean they're positive, but you have paranoia, you have hallucinations, you see things, you hear things. Those are called positive symptoms. Negative symptoms are, they have negatives, and they usually anhedonia, anergy, no energy, amotivational. So they have all those kind of which in Greek means not. So you see an A in front of something, it means not. So hedonic means pleasurable, and means not pleasurable. So anyway, anhedonia. So he's talking about, again, the endogenous depression there, the depressed moods created by the endotoxins, or there's the endotoxins and there's the excitotoxins, but this is the endotoxins.
To pleasurable stimuli. This is an important symptom of depression. No work has been done, that is, until now. Within hours of endotoxin hitting their bloodstream, these experimental subjects not only started to feel depressed, but they had significant reductions in activity in the reward center of their brain. They were less excited about winning money playing video games, for example, in this study. But by eliminating animal products and eating antioxidant-rich diets, we may be able to prevent or treat depression.
So another one of his studies, he had, like I said, you have 3 to 4 servings, 7 to 8 servings of fruits and vegetables will make a difference. The endotoxins produced by animal products, fats, high fatty foods, things like this is all there. Gotta watch my time, I have to wrap it up. So anyway, we had a good study. There's lots to learn about the brain. It's just fascinating how God has made the body and all the parts and how they interact. And part of it is to be protective to us, to know, oh, this isn't good for us, this is good for us. And part of it has been to, maybe as a result of sin, things have happened to our bodies that create this. And unfortunately, all the nutrients that are buried since the flood in the soil, and special plants, you know, they could have probably been curative of this and kept people living longer. And hopefully with the Tree of Life, we can do that.
Obviously, I mean, we get knowledge, we get, you know, information, we go through mechanically these things. But what seems to make them real is the enthusiasm, the excitement
Yes.
of,
Well, let's finish with a little word of prayer. Our Heavenly Father, thank you for the study. Help us to look forward to each week where we can learn more about our bodies that you have created and made. Help us to treat them well so that we can live long and healthy life which you want us to have. Bless us now and bless our families, we pray in your name. Amen.